Good morning, all. It's been my pleasure to introduce Dr. Nsouli.
Nobody does.
He has more than 100 research papers, and you will be well informed and entertained by what he's about to say. So please join me in welcoming Dr. Nsouli.
Thank you, Richard, for your kind introduction. Ladies and gentlemen, good morning. Messieurs, dames, bonjour. Buenos dias, buongiorno, sabah al-khair, and guten morgen. That's the only thing I know. First of all, I would like to welcome you all to this wonderful allergy educational meeting, and I would like to certainly thank Sherry Bennett, Ms. Sherry Bennett and Fanny, who worked very hard in putting this meeting together, and would like to give them a round of applause. Also, I would like to thank Dr. Richard Kennedy and Shahi Prabhakaran, a nurse practitioner, and all the members of the medical unit for their trust and confidence. Certainly, I would like to congratulate Dr. Brian Davey, being appointed the new director of the medical unit here at the World Bank IMF. And I have a question for you. Have you been experiencing any allergy symptoms within the last 3 to 4 or 6 weeks? Show the hands. Itchy eyes, water. Here we go. Great. So it's a great pleasure for me to be here today to share with you some important clinical data and important clinical tips and pearls on state-of-the-art allergies. I will be certainly covering what I call Be Allergy Alert, past, present, and future. And this program will allow you to learn how to protect yourself and your families against allergies. This is going to be a very nice special presentation, since I will be taking you in a allergy safari tour. We'll be going on a tour, on an allergy tour. And during this tour, we'll be learning a variety of things about allergies. First of all, we're learning, number one, why and how one can become allergic. Number two, what are the different factors that can cause allergic reactions. Number three, what are the symptoms of allergies. And number four, how can we treat allergic reactions, with the covering also what could be the complications that can occur from allergies left untreated, and some future perspectives as well. I will be leaving certainly ample time at the end of the presentation to answer all your questions, if I know how to answer them. And now I would like to ask you, please, to fasten your seatbelt. We are taking off. So if you look from the window, or you're outdoors nowadays, within the last 6 to 8 weeks, we have been seeing a major explosion of pollen. Pollen is everywhere. And the trees have been extremely generous in causing a very severe allergy season. And I still do not understand how some people, they are in love with pollen. Now, I wanted to only tell you that within the last 6 to 8 weeks, I have been called and interviewed on 5 or 6 different TV channels about allergies, and wondering why this year we have been having a major allergy season, why we have been having an early allergy season, and why people have been suffering due to the pollen. Now, as you see in here, we do have several factors. The first factor is the heat factor. As you well know, so far we did not experience any winter, and we're still waiting the snow. That might not occur. And a warming phenomenon has an effect on the pollen. We know that the solar energy comes and, let me see if I can do it from here. The solar energy comes and can affect get reflected on Earth, and some of this solar energy get absorbed, and some of it get re-reflected up in the atmosphere. Due to the ozone layer in the atmosphere, this heat get re-reflected on Earth, and there is significant absorption that has been occurring, trapping of the heat, resulting in an increase in temperature. So what happens when we have an increase in temperature? When we have an increase in temperature, we have early pollination that will occur. You see it on the right side of the slide. Number one. Number two, we have early flowering, causing severe allergic reaction. Number two, As you know, we do have an increase in combustion that has been occurring, and combustion has been leading to increased production of greenhouse gas. What's a greenhouse gas? You know it. It's a gas composed of CO2, water vapor, methane, ozone, and other chemicals as well. The ozone by itself, although is the 3 molecules of oxygen, when they bind together, instead of helping, these could be hurting. And ozone by itself can cause significant allergic reaction and irritation in the nose, in the eyes, and in the chest. So the increase of CO2 has been shown to increase productivity of the pollen, so we have a higher concentration of pollen. Number 2, we do have also an increase in the allergenicity of the pollen. So the pollen with the CO2 becomes more refined, if you wish, and gets very quickly to allergy receptors, causing allergic reactions. All of the above collectively will lead to what? Will lead to what we call the perfect storm. Not the perfect storm fighting against wave and wind, but is a perfect storm fighting against pollen. Now, as I mentioned, that the allergy season has been causing misery, and it's a patient that we saw several weeks ago with major allergy symptoms, itchy eyes, watery eyes, blocked nose, exhausted, unable to sleep. And this certainly shows you that allergies can affect the quality of life of the people that are suffering from allergies, and is no longer considered as simply a disease of the nose. Now, within the systemic type of symptoms that one can get from allergies, as I mentioned, that nasal allergy, hay fever, does not only cause nasal congestion and sneezing, but can also cause some systemic effects such as fatigue, tiredness. And this is a study that we conducted recently. We showed the impact of allergic rhinitis on chronic fatigue. So these patients that came to see us with allergies, their fatigue score was very high. We evaluated these patients, we treated these patients, and guess what? There was 76% reduction in the degree of fatigue of this patient. So therefore, it's very important. Why is it important to know about it? Because if we have tiredness and fatigue, this will certainly affect our productivity at work and at home, and it can really affect the quality of life. Therefore, this is something very important. We presented the study in Boston. As you see on the bottom, I have the Talal Nsouli and Samir Nsouli, both of them. These are my children that co-authored the paper. Talal is in nursing school. She will be finishing soon. And my son Samir is in pre-med. Also, he has a long way to go, but he is interested in doing some studies. Now, this is how the Time magazine depicted a typical prototype patient afflicted with allergies. You can initially appreciate that this individual is not only suffering from nasal congestion and sneezing, but this person looks tired, fatigued, disoriented, confused. Yes, all that due to allergic rhinitis left untreated. The quality of life is certainly affected. Now, what can trigger allergic reaction? If you go from the right to the left, environmentals, you see tree pollen and grass pollen can also cause allergic reaction, exposure to dust mite, mold spores, cat and dog dander, all of these can cause allergic reaction. In terms of ingestion, something that we eat, foods, often people are allergic to foods, shellfish, nuts, tree nuts, dairy, and eggs as well. If they are injected, if someone is allergic to stinging insects, we call it Hymenoptera venom hypersensitivity, we get stung by a yellow jacket, and then we get a severe reaction that could be a local reaction, not to worry about it that much, but it could be a systemic reaction that can very quickly result in an anaphylactic reaction. That means that can lead to death if it is not treated appropriately with a life-saving device that we'll be discussing about it later on. If we are in contact with the allergen, as you see it on the left side of the slide in here, what we see that exposure with the poison plants could be a reaction. Often people tell me that I got exposed to poison ivy, poison sumac, and have been having some reaction. That's a normal reaction. So we all normally, 80% of healthy individuals do react to poison ivy and poison sumac. That's a good sign. Now, if we have an immune deficiency, one of the deficiencies that we see in patients that are afflicted with HIV, their cell-mediated immunity against poison ivy is no longer there. So if we take a piece of poison ivy and we put it on the hand of someone who has an immunodeficiency, we'll see no reaction occurring. Animal dander can cause reaction, pollen, and latex hypersensitivity. We are seeing a significant increase in the incidence of latex allergy. Why? Because we are using a lot of products to protect ourselves, a lot of gloves, and these have been certainly sensitizing us more and more and causing severe allergic reactions. So I have a question for you. What do you think we are looking at in here? Is this a special type of shellfish? Is this a out-of-space microorganism? No, you know it. This is dust mite. But this is dust mite seen with electron microscopy, about 5,000 times bigger than what we see. We cannot see it with the naked eye. And the question, where do you find dust mite? We have it, dust mites are everywhere. Mainly we see them in the bedding, in the mattresses, in the pillows, in the carpeting. And so what's happened, we are sleeping with our enemy if we're allergic to that. So I will talk with you later on and to tell you how to avoid exposure to allergic to dust mite by doing the environmental control. What else? We could be allergic not only to environmentals, but we could be allergic to ingestants, foods. Mainly food allergy. We do have fish, shellfish. We do have also the nut and tree nuts. Peanuts certainly is a major problem. We have been having, in total in the United States, I think we lose about 185 people that do die from food allergy every year in the United States. Totally unacceptable. Why? Because these individuals were not seeking care by the allergist specialized in this type of disorder, and they were not prepared with the appropriate EpiPen that I will be talking about it later on. We can have reactions to eggs, dairy products as well, and a variety of other foods one should be aware about. So now what are the symptoms? If we have allergies, what do we experience? You know it. We are starting with the eyes. We get itchy eyes, watery eyes, red eyes. We get sneezing, nasal congestion. We get rhinorrhea, which is a runny nose on regular basis. And also, if we have some skin allergies, we get a red, itchy rash that can occur and could be scaly in patients with eczema as well, but it causes significant problems. Also, what you can see in allergies, we can see that some patients do develop some dark circles under the eyes, and these are called the allergic shiners, due to the fact that we have a poor blood circulation caused by the congestion, and this would result in these dark circles under the eyes. And then we become mouth breather, as you see it in the middle bottom slide in here. When we are a mouth breather, we're going to develop some dental malformation that will require very expensive orthodontic treatment in the future. So therefore, it's very important not to be a mouth breather, but to breathe through our nose. And some people, they rub their nose up and down to clear their allergies. Unfortunately, it does not work. And by doing that on a regular basis, they will develop a little line in here called the allergy transverse nasal crest. Now, if the allergies, they move not from the eyes but to the nose, and from the nose to the lungs, we're going to develop what? We're going to develop asthma. And studies showed if we do not treat nasal allergies appropriately, 45% of patients will finish by developing asthma. Studies done at the NIH and some studies that we conducted in 1992, we showed the correlation between the upper airway and the lower airway. So hence, it's very important whenever we have rhinitis, nasal congestion, stuffy nose, to treat it appropriately in order to prevent the progression for asthma, since asthma is a much more serious allergic disorder. And patients, what do they experience when they have asthma? They get wheezing, cough, shortness of breath, difficulty breathing. It affects their quality of sleep at night. And in some cases, this can lead to a major asthma attack that can result in blockage of the airways that can lead to death in some cases. In the United States, we have about every day 14 people that die from bronchial asthma. And this is totally unacceptable. Why? In my personal opinion, because asthma therapy takes a new turn with the outstanding therapies available, with the outstanding protocols available from the American Academy of Allergy, American College of Allergy, the NIH guidelines that are extremely important to follow. But again, we have to communicate and we have to educate and we have to talk about what's available. This is a patient that I met last night. No, I'm kidding. I never met this patient. This is how patients feel. They feel that their head is very congested and really they cannot function, they cannot work. Now the question, could you have an allergy? So possibly yes, possibly no. If the allergy lasts, if the symptoms last more than 1 week, if they don't change or run a course, or if they are seasonal. We get them more during, let's say, August the 15th. It means most likely that you could be allergic to the rag with pollen, and this is something typical that we see. Or that there is some worsening of the allergy symptoms in different scenarios, different places at different time. We go to the barn, we are doing horseback riding, we come back and we get wheezing, cough, difficulty breathing. We have certainly an allergy. It's important to keep in mind. So now the question is, how do you find out to what someone is allergic to? What's the best test to detect an allergy in an individual? In 2012, still the allergy skin testing, the most sophisticated and the best test that one can do. We put then a drop of the allergy of the vaccine on the skin, the allergen. We do superficial pricking and wait about 10 to 15 minutes. If we are allergic, we get a red, raised, itchy rash, allowing us to know through the allergy skin testing, number one, whether or not we are allergic. Number two, to what we are allergic to. And number three, how severe are our allergies for we providers to provide you with a tailored, appropriate treatment to improve your symptoms. The second test on the right side of the slide shows you the breathing test. So when you're having some cough or difficulty breathing, we have a special breathing test called spirometer machine that you blow in a tube that goes in the computer and will tell us exactly for your height, your weight, the lung function, allowing us to evaluate and to gauge the severity of the disorder, again, to provide you with the appropriate treatment. Now, there is a new device that just came out and has been approved by the American Thoracic Society very recently called the NIOX, nitric oxide analyzer. This is a major revolution, it's a breakthrough in the field of asthma. And this is a machine that analyzes the fumes. When we exhale fumes from the lungs. And if we have asthma, we are exhaling a high concentration of nitric oxide. And according to that, we'll be able to know how severe is the asthma of this patient. And again, to select the appropriate treatment. Very important device. Again, we're featured on a couple of the TV channels talking about this breakthrough. I think our clinic, without a fear of contradiction, I think we are the only clinic in the Washington, D.C. who has this machine. I think maybe the Washington Hospital Center just got one. We can also test for chemicals and cosmetics. Often people come with rashes and come with significant itching of the skin. And often these are caused by things that we apply on our skin. We do it to ourselves, and then we become sensitized. Often patients tell me, no, Dr. Nsouli, I saw a patient last week. She told me that's not possible because she has been using the cream for about 5 years, and how in the world she's allergic to the cream right now? The answer is that when we apply something on a regular basis, our immune system produces IgE immunoglobulins that are the allergy proteins. Let's keep a simple language in here, okay, and that will start to attack the allergen, causing an allergic reaction. And this lady that came, as a matter of fact, she bought very expensive cosmetics from Paris, and she had a small jar of cosmetics to remove wrinkles, apparently. She bought it in Paris, from the Champs-Élysées, one of the nice places there. And so she told me that she paid $1,600 and in no way that she's going to get rid of this, and that my diagnosis is wrong. So I told her, you're going to keep the jar with me, and I will trust you, I will give it back to you, but don't use this anymore. You're going to use my creams to cut down on your reaction. Okay, and you're going to come back in 1 week and see how you're going to be doing. So she came back in 1 week, and all her skin cleared, her skin looked much better, and she improved. And therefore, I was very happy. And suddenly, I took this jar and I threw it in the trash, and she almost attacked me. But she told me, you're right, let's keep it there. We don't need it anymore. So again, it doesn't go with the price. Okay, and often told me, my products are very expensive. I buy the most expensive cosmetics. A quick tip, if you have some cosmetic sensitivity, some skin reaction to cosmetics, there are two of them that are hypoallergenic. Number one is Almay, and the second one is products made by Clinique. We can also test for jewelry as well. Nickel allergy can cause significant sensitivities by using a test called the True Test. So it's a patch test that we put on the back. We keep it between 24 to 48 hours, and we can get very accurate results. Patients with allergies can also experience some ear discomfort, some pressure, some popping of the ears, and this is something quite bothersome, especially if these individuals are flying very often. And we use a electronic tympanometry that will allow us to detect fluid in the ears or negative pressure, again, to tailor the appropriate treatment. So what the ears have to do with allergies? Very simple. As we mentioned that the nose is a target, is it a shock target organ for the allergies, but the nose is connected with the ears through the eustachian tubes that connect the middle ear with the back of the nose. And if we are congested, we'll get blockage and we'll get some negative pressure, including fluid. If we want to go in a more detailed exploration, we can look at the sinuses and examine the entire nasal cavity and the pharyngeal cavity by using the flexible fiber optic endoscope in here, which is, these are fiber optics that we send in the nose. We give a little local anesthesia to the patient, we decongest the nose, and very slightly we can do the procedure. It's a very comfortable procedure, and there is no significant pain in here. The patient on the right side has been having problems for about 6 to 8 months. She saw about 4 different doctors. They are prescribing medication and other things without significant improvement. When I scoped her, I found out that she had a polyp. The center picture on the bottom shows you this gray, opalescent, shiny mass. That's a polyp, which is a benign mass that grows in the nose and causes nasal blockage. We had to treat her with the steroids and other medication to dissolve it. Also, what you can do in terms of exploring, we can order a CT scan of the sinuses. This is a high-resolution, high-quality imaging that will show you all the different sections in the sinuses. As you see the model, in the middle we do have the sinuses that are shown. On the left, we see the normal sinuses. The black, the sinuses are open. And on the right side, we see the opacified sinuses that shows sinusitis in these patients. So it's like a bed that you lie down in this bed, and one can go through this donut 2 or 3 times, and we get very high-resolution imaging. This is a very interesting study that we did recently. Several weeks ago, I was in Orlando, Florida, at the American Academy of Allergy and Immunology. The weather was great, and the food was fantastic there. About 9,000 allergists attended this meeting. And we presented a study on the relationship between asthma and allergies. Often this is something that people are not aware about it. And what we found that patients with asthma, that 76% of asthma is caused by allergies. So if we are having wheezing, cough, difficulty breathing, it's important to have an allergy evaluation in order to avoid the offending allergen and to start to get the appropriate treatment. One of the co-authors on the study, of course, my clinical associate were involved with that, but my daughter Susie also was involved. You see her on the left side when she's working at the hospital, on the right side when she's doing her pageant. And she will be finishing soon, I think, in a couple of weeks. Now, what happens if asthma is left untreated? So if you're having cough, wheezing, some people say, it's not a big deal. I'm going to take a cup of coffee and or a cup of tea. I'm going to take a couple of aspirin and things like that. The answer is not as simple. Studies are showing that if asthma is left untreated, first of all, what's asthma? We mentioned is an allergic disease of the lungs, where the air tubes that you see in here get very constricted. We have thickening of the lining, and we have mucus secretion. And this mucus, called mucus plugging, can block the airways completely. We get carrot of mucus that can lead to asphyxiation, hence death from bronchial asthma. So what can happen if this is left untreated? With the time, this can lead to irreversible lung damage. So we can have some scarring phenomenon called fibrosis that can occur, and then we are dealing with an irreversible lung damage that could be very difficult to treat in the future. The clinical pearl, if you have asthma, please have your asthma treated appropriately. Have 3 symptoms on asthma in order to prevent what we call in the medical field airway remodeling. I don't like the word remodeling because if I remodel my kitchen, I'm making my kitchen looking better, but in here it's a scarring phenomenon that they call it like that. So this is a nice picture that gives you an idea about what's happening with our nose and our sinuses, and it shows clearly on the right side of your slide. You see what happens when someone has allergies. We have mucus secretion that collect in the sinus. Remember, a sinus is a tiny pocket. We do have several pockets, the maxillary pockets in here, the frontal pockets, and we have the ethmoidal ones and the sphenoidal ones. So they get filled up with fluid. And once they get filled up with fluid, the fluid accumulate, and we can get infections, especially due to the fact that the clearage, the windows are closed due to allergies. Now, this is a fascinating phenomenon, a very new phenomenon in the field of medicine called biofilms. What's a biofilm? So let me tell you the story. Normally, when we get an infection, the bacteria that sits in our nose, the bacteria that sits in the lining of our sinuses, usually you see it on the left side. It's sitting there. The lining of the nose or the sinus is represented by the black bar in here. And normally, what happens is that we produce antibodies against the bacteria, and the antibodies will get to the bacteria, will kill the bacteria in a simplistic manner. Now, if we are unable to do that, then we have to get antibiotics, and likewise, antibiotics that we take will get in the bloodstream, and they get to the bacteria, they reach to the bacteria, they inhibit the replication of the bacteria, getting rid of the infection. However, the bacteria are becoming very smart. They are building their own house. They are building a shield that you see in gray, yellowish in here. So they are hiding in their own shield where they cannot get reached by the antibiotic, and they cannot get reached by the immune system, and they continue to come in and out and causing a recurrent infection. Very fascinating. So on the left side of the slide, you see normally antibiotics and the immune cells will get to the bacteria, but once they are hiding in this matrix, is the exopolysaccharide matrix, quite sophisticated, to hide themselves and to protect themselves from that. Therefore, antibiotic and immune system is no longer working, which is a major problem in the field of medicine. Now, we did a study a while ago and a study recently showing that Bactroban, which is an antibiotic nasal spray, if it's used on a regular basis, can prevent and dissolve these houses where these complex, where the bacteria hides, and therefore prevent this phenomenon. And number two, recent study showed that lactoferrin is an important antimicrobial agent. Lactoferrin also prevents this from occurring. Now, where do we find lactoferrin? Very easy. You have lactoferrin in your nose. I have lactoferrin in my nose, and therefore we need our mucus secretions to be there, and they help tremendously in defending us against infections and preventing things of that nature. And that's why we did a study recently. We showed that regular use of nasal saline irrigation on a regular basis can be deleterious by depleting the nose from its immune elements, causing more infections. And I will be back to that. This is, of course, not a patient that I met, but this is how a patient feels when they are blocked, that their nose is quite blocked. Now, if you have headaches, most likely these headaches could be due to allergies, could be due to environmental allergies. We have histamine-related headaches, and also could be due to food allergy. We published a paper several years ago, and we showed that food allergy could lead to migraine headaches. This is an interesting study showing the relationship between chronic nasal allergies and recurrent sinus infections. So often people could be having sinus infection. After sinus infection, they call their physician, they want to have an antibiotic. So these individuals should be evaluated for an underlying allergy, treat the allergy, and hopefully this will prevent sinus infections from occurring, as we show in our study that there was 80% reduction in the frequency of sinusitis when we treated their underlying allergy. Now, the ear is also a shock target organ, and a while ago we did a study on the role of food allergy in recurrent middle ear disease, and this was a very important study that was published in the Annals of Allergy, and it was so important that the CNN featured our study, as a matter of fact, and we are able to help since that time thousands and thousands of patients that were having fluid in the ears, that were ready to go for surgery, to have tubes done for them, and that were having hearing loss, especially in the young individuals, in young children where they are learning. Learning is very important, so when we have fluid in the ear, we have hearing loss that can lead to speech and language retardation or delay, and that's very important. Now, I would like to tell you in here, or shifting some gears to go a little bit faster, but to tell you, as I mentioned on Channel 7 several weeks ago, that if you are outdoors and driving your fast car, please close your windows. Be sure that your windows are closed to avoid from getting bombarded by the terrible pollen that's sitting out. So this brings us to the treatment of allergies. So we have three avenues of the treatment. Number one, avoiding the offending allergen. Number two, pharmacological agents and medications. And number three, allergy immunotherapy, the vaccine, allergy injections. So the environmental control, we spend 10 to 15 minutes with our patient explaining to them how to decrease exposure to dust mite by using a pillow protector and a mattress protector. These are specialized covers that are airtight with a zipper on the side to avoid dust mite exposure. To use also a vacuum cleaner that has a HEPA filter in order to avoid the exhaust system from bringing the dust up in the air, and also to use an air cleaner in the bedroom to keep it on. Also, it has to be HEPA, high efficiency purifier of air. These are quite effective. It decreases 35 to 40% exposure to dust mite. Number two, we have the medications that are extremely effective when are taken appropriately. We do have the nasal sprays, the prescription ones. The over-the-counter nasal sprays should not be used on a regular basis. The topical nasal decongestants, such as Afrin and Ostrila, they can give you a relief for 1 or 2 days, but after that, you can develop a rebound, and the nose will get totally blocked if you keep on using them. So the prescription ones are very effective, such as Flonase, Nasonex, and Omnaris, the most recently approved, that are safe and effective when they are used at the appropriate dose. And also, we can use the antihistamines, histamine blockers that block the pathway of allergic reactions, and usually we like to use the non-sedating antihistamines. Medications over the counter, such as Benadryl or Zyrtec, can cause significant sedation. As a matter of fact, if we look at the medicine over the counter called Sominex, Sominex is a medication for sleep, to go to sleep. And if you look at it, it contains 25 milligrams of diphenhydramine, which is what? Which is Benadryl. So very important to be aware about it, that we have allergy medication, non-sedating, and that could be very effective. Now, patients with asthma, of course, we do have a variety of inhalers, starting from the bottom with the bronchodilators that open the airways, but they do not prevent the asthma. The second line, these are the controller preventative medication that prevents asthma, although they are inhaled corticosteroids. Taken at the appropriate dose are very safe and very effective. And the third line on the top, that's the line of the combination therapy, the most potent, the most effective medication are used, the Advair, Symbicort, and the recently approved on the right in blue called Dulera, that they work very well in preventing and keeping the lungs quite open. Xolair, it's a very interesting medication, giving as an injection once a month, and this medication blocks also the allergic cascade, decreasing the immune elements that cause allergic reaction, but it's only used in patients with severe allergies. So Xolair is only used for patients with severe asthma when everything else is not working. I think the pharmaceutical, they are selling them for about $1,000 a shot, which is quite expensive. And finally, allergy immunotherapy, allergy injections. And this is a very well-known vaccine, has been on the market for more than 100 years. It was discovered, I think, in 1911 by Dr. Noonan, and it showed that it has major advantages. Of course, when you take medications, we're doing fine, and when we stop the medication, symptoms have tendency to come back. In contrast, when we are taking allergy injections, we are building up our immunity vis-a-vis the allergen, decreasing the sensitivity, and hopefully going on a complete remission for 1 year, 2 or 3 or 4 years, or sometimes the remission with allergy injections could be more than 10 years, or that can lead to a possible cure. Important to know that allergy injections within the last 10 years have been gone through major improvement in the quality, in the purification, in the standardization of these allergy shots, and they are no longer as the one that we used to use before, so we have a superior results with the immunotherapy. So often patients use these nasal sprays that we prescribe, the nasal anti-inflammatory agent that really block the allergic reaction, and they do complain due to nosebleeds off and on, and if they are not used the right way. So we came out with the method that maybe prevent nosebleeds. So if you look at the nose, the septum in the middle is the one that's extremely rich with blood vessels. So if we are spraying on the septum, this can cause some bleeding. So we came out with a technique to spray away from the septum by using the right hand to the left nostril, the left hand to the right nostril. By doing that, we are spraying away from the septum. And this study showed that not only we deliver better the medication, but we prevent and decrease nosebleeds. And there is a story on this slide in here. I was getting ready to go to the American Academy of Allergy meeting in Arizona, and my son, this is my son Munir in here, who did the statistics on the study, so he structured the study, was involved, was one of the co-authors. And we did some nice pictures of him demonstrating this new technique called the CHNST technique, 2 or 3 days earlier of my departure. And then the day that I was leaving, my flight was at 9 o'clock in the morning. I woke up around 4:30. I was reviewing my slides, and suddenly I pushed inadvertently in a place where his pictures disappeared completely. So I had to woke him up early in the morning. It was 5 o'clock. I told him, I want to take a picture of you. He told me that there's no way, I'm sleeping. That's not possible. So please do it like that. And these are doctors. They're going to look at the science. They're not going to look at you. Don't worry about it. So I took a picture of him 5 o'clock in the morning at home before going to the airport. And then I was in the plane. I was happy that I did that. And on the plane, I was analyzing the picture. And I noticed that on his T-shirt, it says in here, the Tiki bar. So I thought I'm going to be not disbarred, but I'm going to lose my license to practice medicine, going to a medical meeting with something like that. And this was his pajama, I think. So in any event, we went to Arizona. At the meeting, it was great. Doctors were very happy to see that. So it was a grabber, if you wish. But I told my son Munir that, of course, when I show his pictures like that, I would like to show his picture not as a guinea pig, but also as a normal person. And this is him nowadays. He shifted. He left the thinking about medicine. Now he's in the business field. And I think that he's doing quite well starting. So if you are asleep, I want you to open your eyes and to look from the windows. Okay, something is coming to us in here. Keep your seat belts on, please. And I have to do a maneuver in here to readjust what's going on. Okay, so the EpiPen. I don't know if you heard about the EpiPen. So the EpiPen is a pen. I should have brought one with me. It's a pen that contains a needle and contains medication. And this is called adrenaline. It has epinephrine in it, adrenaline. And the adrenaline is the most effective life-saving medication that one can have. When we go on vacation with my family, my wife and my 4 kids, I take 3 or 4 of them. None of us are allergic, but we never know what can happen at any time. So we did a study on the EpiPen, and these type of scenarios can occur after being stung by a bee, after being stung by a snake, or having a reaction to food allergy, or having a reaction to latex hypersensitivity, and things can go very quickly. Within 5 to 7 minutes, we can have severe allergic reaction, and the blood pressure goes down, the throat starts to close, so we don't even have time to call 911. Therefore, it's important to have one if we have known food allergy or Hymenoptera stinging insect allergy. So what we showed in our study, that people that came to see us with the EpiPen, 72% of them did not know how to use the EpiPen. It's a disaster. So why do we have a life-saving tool that we are carrying with us and we don't know how to use it? It's like we are driving our car on the so 70% of the time we cannot use it. It's like we are driving our car on the highway. 70% of the time the airbags are off. So this is something very serious, and certainly in our study we found out the statistics, and then we advise physicians that every time your patient comes to your office, you should ask your patient to demonstrate with the demo whether he or she knows how to use the EpiPen, since it's a life-saving device. And this is a study that we presented. Now, what about nasal saline irrigation? I think many of you are using the nasal saline irrigation with the big bottles and jars and the sprays. They come here, they go in here. We put the water on the left, come out of the ear, etc., etc. So we did a study on that. Okay. And believe it or not, we wanted to see how the nasal saline irrigation can do. And this is the first really scientific study showing that. So believe it or not, and we showed that long-term use of nasal saline irrigation on regular basis certainly is not helpful, but could be harmful. So this is what we showed, that if you take the nasal secretions on the left side of the slide and you analyze the nasal secretions, you notice these red pigments that are shown on the left. When we are washing our nose aggressively with the nasal saline irrigation, we are taking away these immune elements shown in the red pigments and causing more infections, since our immune system our nose is depleted from these immune elements, increase in sinus infections. So the conclusion that when we stopped the nasal saline irrigation in our patients, there was about 72% reduction in the frequency of sinusitis. And again, the answer is maybe short-term, could be used for 1 or 2 days or 3 days, but using it on a regular basis is not the answer. And that's why I think if you want to use your teapot or your coffee pot, please use it not to put it in your nose. Use it to enjoy your coffee and your tea. I mean, this is. So it's important to follow medical advice, removing allergy triggers, understanding and follow up on the treatment plan, know why you're taking this medication, for how long, and schedule regular follow-up with your physicians if you are getting your treatment. Every year we do on Capitol Hill the allergy screening program. So we screen the senators and the congressmen, congresswomen to see if they have allergies, and many of them have severe allergies. Interestingly, a little story behind it. One day I remember they gave me the title of being the chair of the program. I don't know what value it has, so I have to do a lot of work and organize it. So we were we got about 6 or 8 allergists screening the members of the Congress and the Senate, and we had a great deal of media there, and there was one of the individuals that came to take the screening. He refused to give us to write a consent form that if he's blowing in a machine, because we have machines that we use there, if he blows in a machine or there is anything, we are not responsible. And he refused to sign it. So they told me, now you have a tough case, see what you can do with this gentleman. So he was a very respected, very well-known senator. And he told me, sir, I'm not going to give you my signature. And I want to take the test. I told him, sir, I recognize your name, and you are the one who did these regulations. If you did this regulation, you have to abide by the regulation, and you have to sign it. He looked at me. You're right. You are well read, and he signed it at that time. So therefore, we informed them on the importance of allergies. And a recent study last year that I presented, this study was not done by me, it was done by a variety of societies and non-allergy societies. And they found out the treatment by the allergist, immunologist, will provide better outcome at a lower cost. So seeing the specialist, you are getting immediately the appropriate problem resolved, the appropriate treatment resolved, and versus going from non-specialist to non-specialist. And so this was a very interesting study. I'm going to close with a couple of slides in here in terms of some new things that came out. This is called the balloon sinuplasty. So people that get recurrent sinus infections, the windows of the sinuses are quite blocked. And sometimes what they do, there's an insertion of a catheter that goes in the nose through the opening of the sinuses, and this balloon gets inflated, enlarging the window of the sinuses, facilitating the drainage. Of course, keep it in mind that allergy treatment is first, and that surgery for the nasal cavity should be done as a last resort. And I'm going to finishing with this last futuristic slide, that the future of allergies, on 2 components, epigenomics and pharmacogenomics. So what's epigenomics? Very simply, we know that our chromosomes carry all the coding and all the information to express what diseases, to express what we call our phenotype. And what happens on the chromosomes, we have some proteins that are sitting on these chromosomes. And at a certain time of our life, these proteins, they move, allowing the chromosome to do a transcription, to express themselves and to express disease. What does it mean? It means sometimes we have patients that never had any allergies, and they are 50 or 60 years of age. They come in our clinic, and they are having allergy symptoms. So we can develop allergy symptoms at any age through the epigenomic phenomenon. What's pharmacogenomics? Pharmacogenomics, correct. Very interesting, fascinating type of science that will be coming out in the future. And you see we have some type of electronic material in here. So what we'll do in the future when patients come to our office, we take a little specimen from the inner cheek of the patients, saliva and some of the cells that we scrap it. We put them in a chip, and this chip, through the nanotechnology system, will allow us to know what the patient will be responding to and what medication the patient will no longer be responding to. So it will allow us to select the appropriate treatment, since we have different response to different medication. It's something very fascinating. And the third one is the pharmacoeconomics that I'm not going to discuss in here, because it's a very complicated topic for me. I would like to finish with a couple of nice slides in here. These are some of our patients that despite their severe allergies and asthma, they were able to go to the Olympic Games. On the left, during rowing, and on the right side in the swimming competition at the Olympic Games, and in the top middle, this is also running track. They came out with bronze and gold medals, so we are very proud of that. And I'm showing you that, of course, not to brag, I'm showing it to tell you that there is no limit, no matter how asthmatic you are, no matter how allergic you are, you can achieve and you can do whatever you want with the appropriate treatment by the allergist. So now it's time to come back to National Airport. We are landing right now. And I'm going to conclude by take-home message that, number 1, allergies and asthma are serious diseases that there is nothing to sneeze at. And number two, misdiagnosed and inappropriately treated can result in complications such as sinus infection, ear infection, progression to asthma, and affect the quality of life. And number three, that anyone who is suffering from allergies could be treated appropriately, could have allergy-free symptoms by seeing the allergist, immunologist. Not only that we improve the symptoms of the patient, but by doing that, we'll be improving the quality of life of the patient. And now you can go on your motorcycle during the allergy season and no more allergy and no more sinus problems. Now, I forgot to tell you, our last study was featured in different media in the Web MD, Shape Magazine, Health Magazine, Woman Magazine, Prevention Magazine, US News, Washington Post, NBC News, and Fox 5. But the most important one apparently was the Oprah Magazine, when the Oprah Magazine interviewed me on our study. And some people told me at the hospital, Dr. Nsouli, congratulations on your study. I told them, guys, my study has been published 2 months ago in the Annals of Allergy, the top journal in the world. Told me, no, Oprah is more important. So I think I'm honored. And that's the only time that my wife really applauded me when I arrived home. So now, where to find relief? Any allergist can provide the relief. Our allergy clinic is in the Watergate office building, a couple of blocks from here. It's a very nice office. We have nice views from there. We are located 1 floor below the Richard Nixon scandal. This is my name below, but this is not me, this is Richard Nixon. And now the question, how to come to my office or to the allergy clinic? You can either take a plane and fly. You see the red arrow in here. You can land right away in our office. Or you can take your boat and park your boat there and you can come. Or you can do some jogging. It will be even healthier to come. And after the treatment, since you will be feeling well, you can enjoy a nice show at the Kennedy Center after coming and seeing us. I'm glad that we finished our presentation in here. And sometimes preparing some of the presentations could be exhausting and could be tiring. I remember I was going to Istanbul, Turkey, at the IACI, European Academy of Allergy and Clinical Immunology. I was invited to give a talk there. And that night I stayed quite late until 2 o'clock in the morning preparing my slides. So I got on the plane and you see me, I collapsed completely. So it was quite hard. But once I arrived, I gave my presentation. It was worth it, because they gave me an award and I was acknowledged about it. So there is no free lunch in life. We always enjoy it. I would like to thank my lovely wife, Susan, and my 4 children for allowing me, giving me time enough to do not only research, teaching, and also clinical practice. And I think we are getting to the end of my presentation. Sorry, I'm getting dizzy now in here. Thank you very much. The nose is open, and I'm open for questions. Thank you.
Remind you, if you have a question, please use the microphone in the middle of the room.
Hi, I have 2 questions. One is, can you get out of the blue and start having allergies that one day you wake up and you have the reaction? And the second one is on this test that you mentioned, the nitric oxide.
Correct, nitric oxide.
Is that a test that you have asthma or not? Because I just had it like 2 days ago, but I don't know what.
Correct. So the first question, whether or not we can wake up and develop allergies. So again, I think, as I mentioned, that the allergies can occur at any age, at any time, through the epigenomic phenomenon. And we see often people that never had an allergic reaction. And we had a patient, I remember, at Georgetown who was having abdominal pain. She was a 72-year-old white female with severe abdominal pain, not knowing what's going on. The CT scan was normal, the MRI was normal, and she was having cramping and pain all the time. So the surgeons say, the best thing we're going to do a laparotomy. We're going to open and look if there is something going on, especially at that age. One has to be sure that they are not missing anything going on. So then they thought that maybe there is potential food allergy. I went to see her in the hospital, and I told her that maybe this could be food allergy, and she was open to the idea. I told her before them doing any surgery on you, let's give you a chance and look what could be going on. And she denied it completely. She told me, I'm 70 years of age, I never had any allergy, I don't see why I'm going to have them. So I did allergy testing on her, and she had a big reaction to cow's milk. And she drinks every day about 2 or 3 glasses of cow's milk. So she told me that I'm totally wrong, and this is why she's in good health, because she drinks milk all the time, and this is nothing to do with her abdominal pain and cramping. Believe it or not, I spoke with the surgeon, so we decided to wait 2 or 3 days without the cow's milk, and believe it or not, her cramping and her abdominal pain went away. She continued not to believe me because she has been drinking it for 7 years. We told her, now we're going to give you the milk and see what's going to happen. As soon as she's starting to have the milk in the afternoon, cramping and abdominal pain. So this is someone that we saved a surgical procedure due to an allergy that occurred late in age. In terms of the nitric oxide, it's more done for asthma, for patients that do have asthma. And especially if the asthma is not well characterized, this nitric oxide analyzer will allow us to very quickly determine whether or not we have asthma. I hope I answered questions.
Thank you, Dr. Nsouli. I have a question. Do you have any recommendations of how to sleep with the enemy, with the dust mites, of where to find these types of appliances for your mattress and pillows?
Correct. I think that's an important question. The reason is that the first step in treating allergies and asthma is not to jump on the medication, not to jump on the antihistamine or the allergy injection, is to avoid the offending allergen. So once we find out what we're allergic to, the environmental control is very important. These pillow protectors and mattress protectors are sold in some allergy supply companies. So they are not the one that you can buy at Macy's or can buy at Nordstrom. They are very specialized companies that do that, and that one can order them. If any of you could be interested, we can give you the name of some of the companies that the American Academy of Allergy use them, and you can select where to buy them, but they are very effective and very good ones. Dr. Kennedy.
What are your views about patients who have been having allergies for years, and then they've been controlling it pretty well with nasal sprays and things like Allegra or Zyrtec or Claritin, and then the allergy season comes up again like it is now, and all of a sudden the things, particularly the antihistamines like Allegra and Claritin, don't work? Is that because they've developed a completely different allergy, or is it that the antihistamines are no longer as effective?
I think that you gave the answer. I think all of the above. We notice sometimes that individuals that are taking antihistamines on a regular basis for years may develop some degree of tolerance, although it's not published. But we notice that there is some type of tolerance to the medication, where the medication is no longer doing the effect that was supposed to do initially, so we switch him to another antihistamine. But I think the most important thing is to know that not only a single agent will help, we have to use a combination of therapies, using the nasal topical corticosteroids that are extremely effective, that block all the cascade of allergies, using the antihistamine as well, and maybe adding a new medication to them, such as the leukotriene blocker Singulair, that has been shown to be quite effective. But certainly to have a talk with the patient, finding out how the patients are sleeping. If they're sleeping with the windows open, the pollen is coming in at night, and they're exposed to the pollen at night. They wake up in the morning and they're having some symptoms. So I think an important evaluation of what could be going on should be done. And we see these patients often. You're absolutely right. This is a problem. So again, there are other windows that one can look at in order to address this problem.